Hi, this is Dr. Mark Herreri, and today we're going to go over a Barbotage procedure for calcific tendonitis of the shoulder. Here we have our setup. You can see the ultrasound machine. We have a syringe with lidocaine for numbing and 2 syringes with saline for breaking up the calcium deposit. Here we are looking at the supraspinatus tendon on ultrasound with the calcification within the tendon that we're going to try to break up with the procedure. After we have the patient positioned correctly and we identify the deposit on ultrasound, we numb the area with lidocaine using a 25 gauge syringe. We numb from the skin down to the calcification so the procedure is much more comfortable for the patient. Here you can see how the patient is positioned for the procedure with her hand on her hip and her elbow backwards. This brings the deposit more towards the front for easier visualization. Once the lidocaine has kicked in and the patient is numb, which usually takes about 5 to 10 minutes, we can start the rest of the procedure. The patient is positioned again in the same position as previously. We identify the deposit on ultrasound and then insert an 18 gauge needle with the saline attached to it down into the calcification. Put pressure on the syringe to inject the saline into the deposit, as you can see it rising and falling with each push of the syringe. The deposit is kind of like a chalky rock, and calcific residue gets pushed back into the syringe and shrinks the size of the deposit. We keep repeating this motion until the calcification has fully resolved or no more residue is being pushed back into the syringe. Sometimes multiple syringes are necessary in order to complete the procedure. Here you can see what the syringe looks like at the end of the procedure. Previously it was clear, filled with saline. Now, in addition to the saline, it is also filled with calcific residue from the deposit that was in the shoulder. Following the procedure, the patient is instructed to take it easy for a couple of days. Pain medication is prescribed if needed, and they should start to feel better within 2 to 3 days of the procedure. And that is how we perform a barbotage for calcific tendonitis of the shoulder.